So let's start with our section 1 of the lecture topic, diseases of external auditory canal. And in this section, we will talk about some congenital disorders and trauma. We divided this section into congenital disorders and trauma, and we will talk about some different congenital disorders that affect the external auditory canal. We will talk about atresia of external canal and Collaural Fistula, and also trauma to ear canal and how we can manage it. So first, what are the different types of injuries or disorders that can affect the external auditory canal or external ear? So before we start with the different types of disorders, let's review just the basic anatomy of the external or the outer ear. As we already talked in detail about the anatomy of the ear consists of external ear, then we have middle ear, and then the inner ear or the internal ear, also known as the labyrinth. The external ear, the outer part which is visible is known as the auricle. So this part is the auricle of the ear, external ear, auricle, and the lower part is the lobule, and it's also the pinna or the auricle. So outer ear. From the outer ear, from the auricle, then there is a canal known as the external auditory canal or the meatus. So external auditory meatus or the canal. And this external ear ends at the tympanic membrane or eardrum, and it is also known as the myringo. So anything related to eardrum, tympanic membrane, we can also mention it as myringo. So this is the tympanic membrane. External ear ends at the tympanic membrane. After the external ear or the tympanic membrane, the middle ear starts, and the middle ear mainly consists of the ossicles. Ossicles are the three bony structures present in the middle ear. So middle ear is ossicles, three bony structures, incus, malleus, and the stapes or stapes. So these are the parts of the middle ear. When we look at the tympanic membrane with the help of the otoscope, you can see through the tympanic membrane the ossicles also. So this is the external ear or the outer ear. So any problem, any disorder that involves the external ear will affect these parts, the auricle, the external auditory meatus, or the tympanic membrane. So different types of the disorders. It can be congenital disorder, which is present at birth. So congenital disorders. It can be due to trauma. External ear is exposed or is to the environment. So any injury on the head, any fall on the ear. So all these can cause injuries to the external ear. So trauma is very common cause for any abnormality or disorder of the external ear. Then we have inflammation, any infection which can be bacterial, viral, fungal, all these can affect the external ear. So inflammation is also a very common disorder or disorder that can involve the external ear. Then we have different tumors. We will talk about different tumors that affects the external ear later on. So different tumors can also cause abnormalities or disorders of the external ear. And also some different miscellaneous conditions can affect the external ear. So these are all the types of abnormalities that can affect the external ear. Then some congenital disorders that can involve the external ear. We have one congenital disorder is atresia of external canal, atresia of the external canal. This atresia of the external canal can occur alone, or it may occur in association with microtia. Microtia is the condition we mentioned in our previous lecture. Micro means small and otia is for the ear. So microtia is a congenital disorder in which ear is very small, microtia. So it can be alone, atresia. Atresia again is the small size of the external auditory canal or meatus. So it can occur alone or it can occur with microtia in which the ear is also small. Or it may be associated with abnormalities of the middle ear, internal ear, and other structures. So, two important characteristics of atresia of external canal. It may occur with microtia, means the ear is also small along with the canal, and it can also involve the middle ear or inner ear, internal ear. So it's not only limited to the external ear, but it can also involve middle ear and the internal ear. So this atresia of external canal is divided into 4 grades. In grade 1, it is smaller than normal, but the ear has mostly normal anatomy. So if you can see, more or less it's the normal anatomy, but it's just smaller than the normal. That's grade 1. In grade 2, part of the ear looks normal, usually the lower half. The lower half looks more or less the normal. The canal may be normal, small, or completely closed. So external auditory canal may be small, may be normal, or it is completely closed as well. So that's grade 2. Lower part of the ear looks more or less normal. Then in grade 3, you can see just a small remnant of peanut-shaped skin and cartilage. You can see just a remnant of, it's a peanut shape. And there is no canal, which is called oral atresia. So there is no canal, no opening, atresia. In grade 4, you can see there is complete absence of both external ear and ear canal, and it's known as anotia. Anotia means absence of the ear. No canal, no ear, complete absence. So it's labeled as anotia. So microtia, smaller than the normal, but anotia is the complete absence that comes under the grade 4, which is the most severe type. And in this, there is complete absence of the ear and there is complete absence of the ear canal. So that's the atresia of external canal with microtia or without microtia. Maybe a middle ear or internal ear is also affected. Then the other abnormality is Collaural Fistula. It's also a congenital abnormality, and it is this type of abnormality is due to the abnormality is in the first brachial cleft. Fistula is a connection between the two parts or two structures. So when there is abnormality of the first brachial cleft, it leads to the formation of collaural fistula. Fistula openings, the openings of this fistula are situated in the neck just below and behind the angle of mandible. If you see, these are the openings of the collaural fistula. One is behind the ear and behind the angle of the mandible. This bone behind the ear, if you put the finger on the back of the ear, this bony structure is the mandible. So this mandible, this opening is below the ear, behind the ear, below the mandible, and then the other opening is in the external canal or the middle ear, in the external canal or the middle ear. So that's the openings of the fistula. It is due to the abnormality of first brachial cleft during the embryonic age, or when there is abnormality of the first brachial cleft. The fistula is the connection between the two structures. One end of the opening is behind the ear, below the mandible, in the external canal or the middle ear. Then the other disorder which is very common to the external ear is the trauma. Since it is exposed to the surroundings, any injury, any fall, any hit by the any instrument, hit by the during the playing, usually any hit by the ball, things like that, or fall or any head injury can lead to trauma to the ear canal. So depending on how bad is the trauma or injury, the management is different. So trauma can be, it's a minor laceration or it's a major laceration. Laceration is a break in the skin or there is a cut in the skin. Cartilage, ear is mostly the cartilage. So the first thing you should do when there is a trauma and if there is a bleeding from the ear like this, the first thing to do is to apply pressure. To apply pressure so it should stop the bleeding. After the bleeding is stopped, then you can observe what type of injury it is, if it's minor or major injury. If it's minor, usually after the bleeding stops, clean the wound with the soapy water and then apply some antiseptic or any antiseptic lotion or cream, and usually that can the bruises will take time. The injuries of the cartilage usually takes longer to heal as compared to the skin injuries or the other side of the injuries. So minor trauma, just apply pressure and then clean the wound. You don't need to handle it very vigorously. No debridement is required. But in cases of major laceration or deep injuries, usually suturing is required to stop the bleeding, otherwise it won't stop. And then management is accordingly until the sutures are removed. So depending on what type of injury or whether it is minor laceration or major laceration, the management depends according to that. So that was all about the first section, in which we talked about the congenital disorders like atresia of the external ear. Then we talked about the trauma of the external ear and how it can be managed. And we also talked about the different grades of the atresia of the external ear. So thank you for watching sqadia.com.